Hello there, Bernie here, and welcome to the Cardiac Physiologist channel. If you're interested in an allied healthcare career working directly with patients and helping people to get better, you're in the right place. Grab a cup of coffee and let's explore the world of cardiac physiology. A cardiac physiologist is a specialized type of healthcare professional focused on diagnosing and assessing heart conditions. At a cardiology department, the team is composed of cardiac physiologists with different specialties, nurses, admin staff, and technical assistants. Together, they provide care for both inpatient and outpatients with various cardiac needs. Some are preoperative patients requiring standard assessment before surgery. Others are referred by their GP due to ongoing symptoms or incidental findings. Electrocardiographs, or ECGs, are the basis for investigating heart issues. An ECG is a painless, real-time test taking 10 to 15 minutes. It measures the heart's electrical activity to determine normal versus abnormal conduction or structural abnormalities. Patients remove clothing above the waist and lie on a bed while 10 electrodes are placed on their wrists, ankles, and chest. These connect to the ECG machine while the patient lies still, allowing the machine to print out their heart rhythm. ECG changes can account for a patient's symptoms and guide further testing. Some patients need longer ECG monitoring to capture sporadic issues. A physiologist analyzes the recording and sends a report to the referring clinician. In an exercise tolerance test, heart rate and rhythm are monitored during exercise on a treadmill or bike. ECG electrodes and a blood pressure cuff are applied. Recordings are taken at rest, sitting, standing, and during exercise. This identifies any abnormalities provoked by exertion and is used for patients of all ages and backgrounds. Some patients experience rhythms that are too fast or slow, causing symptoms. A pacemaker is an implanted device that monitors the heart rhythm and delivers electrical signals to maintain a proper heartbeat. A physiologist helps select the appropriate device before implantation. They work closely with the implanting cardiologist to optimize lead positioning and device function. At follow-up visits, the physiologist oversees pacemaker care and remote monitoring. An echocardiogram, also called a cardiac ultrasound scan, uses sound waves to create diagnostic images showing heart structure and function. It's a routine test for patients with suspected or known heart attack, heart failure, valve disorders, or congenital disease. With the patient lying on their side, a probe is positioned on the chest to obtain images from different angles as the cardiac chambers and valves are assessed. The echo machine produces sounds representing blood flow. When combined with an exercise test, echocardiogram can also evaluate mechanical function and coronary artery disease. In the cardiac catheterization lab, physiologists work with doctors and nurses performing various procedures. Diagnostic angiograms use X-rays and contrast to highlight coronary artery blockages. Treatment like stents and balloons open up narrowed vessels. Devices like pacemakers are implanted in the lab. Electrophysiology studies, or EPS, examine the heart's electrical activity to pinpoint arrhythmia sources for ablation treatment. Students training to become cardiac physiologists get invaluable real-world experience in hospitals with actual patients. This prepares them for competent practice and aids them in becoming the best physiologists possible. The key advice for prospective students is to spend time shadowing working physiologists and being inquisitive. Ask questions of everyone and observe as many procedures as possible. Most importantly, engage with patients whenever you can. This will provide insights into the rewarding and varied career of a cardiac physiologist. So, that wraps up our overview of the cardiac physiology profession. If you're inspired to pursue this specialty, remember to subscribe and click the notification bell. We'll have much more to discuss on future videos. Thanks for tuning in today.